The prompt that I am researching is prescription pain medications. Prescription pain medications is anything that is prescribed by a medical professional to reduce pain. Some examples of prescription pain medications include OxyContin, Vicodin, Codeine, and fentanyl. There are around 9.7 million annual abusers for prescription painkillers in the U.S. After looking through many websites and trying to find prescription pain medications abuse in South Dakota, I could not find any statistics. But according to the South Dakota Department of Health, 47% of deaths involved at least one opioid. Since these are prescription pain medications, people that the prescription is written for are able to get these painkillers. But there are many people who don't have a prescription for pain medications, but they are able to get them from their friends and relatives. According to the Substance Abuse and Mental Health Services Administration, about 1 in 5 said that they are obtained the prescription pain relievers they had most recently misused from one doctor, which is about 22.1% of people who have pain medication prescriptions. Additionally, 3.1% said they obtained them from more than one doctor. With that being said, once these people are addicted to these pain medications and they may not be able to get them anymore from their doctor, they may start going to drug dealers to get them. Considering the social stratification, there is not one exact group or particular population that misuses pain medications. But some factors that can influence this include age, like younger people are more likely to misuse pain medications than older people. People who are around a more social environment or have had family history of misuse in pain medications are at a higher risk as well. People who experience more stress due to pain medications having more than just one effect on someone. The effects of pain medications are the main cause of why people start to misuse the drug and abuse it. People use prescription medications after they have had surgery or reduce inflammation from injuries and illnesses. People rely on these prescription opioids to help manage their conditions under the care of their physician. Prescription pain medications are highly addictive. Even when they are taken as prescribed, there is still potential for developing a dependence for the drug. They become more addictive when they are taken over long-term use. Prescription pain medications are highly addictive because they trigger powerful reward centers in your brain. They trigger the release of endorphins, and your brain says that it likes that feeling, which keeps you coming back for more. Long-term health impacts of prescription pain medications deal with respiratory depression, which is overdosing, opioid use disorder, and developing an addiction. Worsening pain may have a long-term effect, as well as your bones may start to become more brittle after taking pain medication over months to years. When someone starts to misuse prescription pain meds, their life expectancy is reduced by 0.67 years. Those who die from opioid overdoses lost an average of 38 years of life. It all depends on when you start misusing and your health conditions that determine your life expectancy. The schedule of prescription pain medications is a Schedule 2. They are typically prescribed to treat severe pain, anxiety, insomnia, and ADHD. According to the National Institute of Health, states that laws dealing with the prescription pain medications at a federal level is a federal controlled substances law, which affirms with the essential medical value of many drugs that are controlled substances. The state states that opioids may be used for an extended periods in treatment of patients with intractable pain. In South Dakota, the law regarding prescription pain medications includes restrictions on the distribution of controlled substances and the requirements for prescriptions and the penalties for violating these laws. It is a felony for unauthorized manufacture, distribution, counterfeiting, and possession of controlled substances. Getting caught with prescription medications that aren't yours or trafficking prescription medications is a federal felony offense with a mandatory minimum penalties of between $100,000 and $5 million in court fines and a prison sentence of between 1 and 20 years, according to the Recovery Village. There really isn't a difference between possession and distribution due to the fact that they are prescription pain medications. The only person that should have them and be taking them is the person who the prescription is written for. Some other additional impacts that affect our communities dealing with prescription pain medications include negatively impacting the community health. This is done by contributing to addiction, overdose deaths, and increased healthcare costs due to misuse, leading to negatively affecting families, workplaces, and overall social groups that hold a community together. After exploring additional crime activities associated with prescription pain medications, I've found that people take these pharmaceuticals from legal sources and will sell them to the illicit marketplace. People also take someone else's prescription medication fraudulently and will use it for themselves or sell it to others. Now, knowing more about prescription pain medications and their misuse, I've learned that it can be a huge impact on families and communities, and even tear relationships of people apart.